So, hi guys. I guess this is the new normal. We're doing neurodegenerative disease and exercise. For Parkinson's disease, we chose Parkinson's because it's easier to focus on one disease than try to do an exercise script for multiple. So, all of us focus on Parkinson's.
Okay, so Parkinson's disease is a progressive disease that affects the basal ganglia, which modulates movement, and also the substantia nigra, pars compacta, which makes dopamine. Dopamine is a neurotransmitter that is needed to feed into the direct and indirect pathways of the basal ganglia. The image on the slide is taken directly out of one of Ben's lectures, and it depicts the direct and indirect pathways. So the red arrows are the inhibitory pathways, and the green arrows are depicting facilitation. So the basal ganglia facilitates the supplementary cortex, which in turn facilitates action. The pathways from top to bottom are the direct pathways, and these are excitatory, and the pathways side to side are the indirect pathways, and these calm down or inhibit the circuitry. The basal ganglia the cortex sends the signals to the basal ganglia to be processed, and then the basal ganglia sends the processed information back up to the cortex for the movements to be made, and you need dopamine for this to run. The 4 cardinal signs for Parkinson's disease is resting tremor, lead pipe or cogwheel rigidity, bradykinesia, and postural instability. And then some other signs are shuffling gait, pedestal turning, which is taking lots of little steps to turn around. And everything just starts to get smaller. The movements begin to get smaller, handwriting is smaller, and even speech is softer. And there are so many other symptoms that you can see, but you can see by the ones that I've listed that they all have something to do with motor control and movements, and this is due to that reduction in dopamine and its effects on the basal ganglia. Okay, so medications for Parkinson's disease. The most effective medication for Parkinson's is carbidopa-levodopa. The levodopa is combined with the carbidopa to prevent the L-dopa from being broken down by DDC. And DDC naturally floats around the blood and breaks down L-dopa before it gets to the brain. This allows the L-dopa to float around for longer and increases the chance that it makes its way into the brain. We use this form of L-dopa as it's the only form that can pass across the blood-brain barrier and reach the brain. Another form is duodopa, and this can be given in an infusion form through a feeding tube where a gel is directly infused into the small intestine. So this is for patients in more advanced stages of Parkinson's that still respond well to the L-dopa treatment. This treatment option requires 2 surgeries to implant the tubing, so that's something to consider before deciding to get this. And the image on the slide is showing the duodopa components. So you can see the little tube going into the small intestine, the cassette that detects the levels of L-dopa in the system and regulates the amount of medication that is pumped into the body, and the pump which administers the medication for absorption. Dopamine agonists are not like L-dopa treatments in that they don't convert into dopamine in the brain, but they mimic the effects of dopamine. And due to this, they aren't as effective as the L-dopa, but they do last longer in the system. And these can also be combined with L-dopa in order to smooth out the decrease of L-dopa in the system. Anticholinergics. Oh my God. Tamara, how do you say that?
Anticholinergics?
Yes. These are used to treat the resting tremor found in Parkinson's disease patients. So it's not like the other treatment forms where it actually treats the whole entire disease. These just treat the resting tremor.
Maybe.
Okay, so the medications can have some side effects, and that can impact how well a person with Parkinson's can exercise. And the medications can be broken down into 2 different categories. There's dopamine replacement therapies and the anticholinergics. And so the dopamine replacement therapies, some of the side effects include discouragement and loss of interest, and inability to move the eyes, trouble breathing, speaking, or swallowing, or uncontrolled twisting movements of the neck, trunk, or limbs. And those can make it hard for the patients to perform some exercise movements. And the anticholinergics have side effects including blurred vision, dizziness, increased heart rate, and reduced sweating and increased body temperature. And a lot of patients who have Parkinson's disease do take these medications because they work so quickly and effectively. Some of the contraindications or barriers to exercise that people with Parkinson's disease may experience are low outcome expectation from the exercise, so they don't think that it's really going to work that well for them, and they might have tightness in their chest, or they have a lack of time to do the exercises, and they may feel that their health isn't good enough to do the exercises, and they just don't want to make themselves worse. And the exercise might make them uncomfortable, and they're not used to feeling uncomfortable. And a lot of people with Parkinson's are also depressed, and so that can make it hard for them to have the motivation to do the exercise. And there's also a fear of falling because of their unsturdiness and difficulties with movement. And bad weather is also a complication because a lot of the programs that are suggested are including walking and just getting around moving more, which is difficult when the weather is not good.
Okay, so the potential benefits of exercise on Parkinson's is improved motor symptoms, bradykinesia, and postural instability, improved fitness and gait disturbances. It can strengthen muscles, improve the balance, so there's fewer falls, improve heart and lung capacity, improve cognition, depression, and fatigue, which are often problems with Parkinson's, but there's still some ongoing research in that area, so it's not really like definite that it helps these areas, but it definitely could, and it enhances the efficacy of levodopa therapy. So I'm just going to walk you through one of the pathways that Dakota mentioned earlier. There's the direct and the indirect pathway. So this is the indirect pathway, which gets rid of unwanted muscle movement. So just starting from the top, the motor cortex excites the striatum with glutamate, which then inhibits the globus pallidus external with GABA, which then goes on to inhibit the subthalamic nucleus with GABA, which excites the globus pallidus internal with glutamate. The thalamus always wants to excite the motor cortex, but the globus pallidus internal, which is just the nuclei in the basal ganglia, sends it inhibitory signals, which controls the movement. So the video I watched describes it kind of as like a leash on how much movement the motor cortex can have. And then the subthalamic nuclei also excites the substantia nigra, which, as we know in Parkinson's, is not working properly and degenerating. So it excites the substantia nigra with glutamate, which releases dopamine. And dopamine goes to the striatum and binds to the D2 receptors, which turns down the activity of excitatory neurons that would activate inhibitory neurons that go to the globus pallidus external, which allows less control of the movement. So that's just a long-winded way of how dopamine controls movement, really. And then this is just, you can see the pathways better, and you can see the dotted lines are where it's not functioning properly in Parkinson's disease.
So I had the exercise impact, and there wasn't, like Jen said, much research on this, but it did say that fewer dopamine transporters allow the dopamine to stay in the synapse longer. So exercise helps with that, and then increase the number of D2 receptors. Jen, do you want to add on that a little bit? You're muted.
Yeah, so it doesn't increase the amount of dopamine that we have, or people with Parkinson's have in their body, because that's like a limited number because the cells in the substantia nigra have died and it can't be regenerated. But it does increase the efficiency of how the body uses dopamine.
Right. And then I focus more on aerobic training. So it was shown to be really high evidence in rats to start that aerobic exercise does improve the mitochondrial function and increases the number of brain-derived neurotropic factors, which is BDNF. in the nigrostriatal system, which is the dopamine pathway. Normally, the expression of BDNF within the substantia nigra accompanies the deterioration of dopaminergic neurons in Parkinson's disease. So aerobic training does help increase the number of BDNF in that system. And then that has a positive impact on Parkinson's patients. So it was, like I said earlier, it was done in rats first, but now there's newer research showing that in Parkinson's patients it does work as well. If exercise was started early in the diagnosis, it often decreased symptoms, or some symptoms didn't appear that might have progressed in the control group. So it did have a positive impact, not only on the rats, but also human. And then I have the exercise. So I'm just going to say that all frequency and intensities can vary patient to patient. Some people might not be able to do moderate exercise if they're later in the stage, or if they just aren't physically fit enough to do that yet. So just start lighter and in like 20 to 40% instead of 40 to 60 for moderate. But just like in the table, it says like aerobic training. They did a lot of treadmill training in the in the research that I did, and the aerobic so the treadmill training, like they looked at, but they didn't look at just like walking generally, like outside or other walking, I assume would have the same effects. But they wanted to do that 3 to 5 days a week of moderate exercise for 30 to 60 minutes. And then for resistance training and flexibility and balance and coordination, there wasn't as much research on that, but exercise doesn't hurt to do anyways. And for Parkinson's patients, they might decrease their balance and coordination. So this will help. And the resistance training is 2 to 3 days a week. Moderate, like I said before, you could go less. And then 2 to 4 sets, 8 to 15 times. Flexibility, it's just like static stretching or PNF patterns, 2 to 3 days a week. And then they have to know to do it to their discomfort, or it's not going to help. So if they're just stretching and they're not uncomfortable stretching, it's not going to help. So make sure that they know that. And then for at least 10 to 30 seconds, but more than that is also recommended. And then balance and agility and coordination, again, 2 to 3 days a week. This is like the boxing club or yoga or tai chi. And then there's not really an intensity for that was listed, but I would say, again, like try to get them in their moderate zone, and then for 15 to 20 minutes.
So to summarize, Parkinson's disease is degenerative and progressive. It's caused by a lack of dopamine secondary to the death of the dopamine-producing cells in the substantia nigra. And the 4 cardinal signs of Parkinson's disease are resting tremor, muscle rigidity, bradykinesia, and postural instability. And there's 2 main types of medications that people will be on, and that's dopamine replacement therapies to increase the amount of dopamine that they have in the system to reduce some of the symptoms, and anticholinergics, which target the resting tremor. And exercise can help improve the motor symptoms and increase the effectiveness of the medications. But the medications can cause side effects that make the exercise difficult, and the motor issues associated with Parkinson's disease can make the exercise difficult itself.
And then this is our references. Thanks, guys.
Thanks.